How to prepare the introduction. Here is what you can do to prepare your family in case the coronavirus spreads in your community. Find local information. Know where to find local information on the coronavirus and local trends of coronavirus cases. Know the signs and symptoms. Know the signs and symptoms of the coronavirus and what to do if symptomatic. Stay home when you are sick. Call your healthcare provider's office in advance of a visit. Limit movement in the community. Limit visitors. Take steps for those at higher risk. Know what additional measures those at higher risk and who are vulnerable should take. Protect yourself and your family. Implement steps to prevent illness. Stay at home when sick. Hand washing, respiratory etiquette, clean frequently touched surfaces daily. Create a household plan. Create a household plan of action in case of illness in the household or disruption of daily activities due to the coronavirus in the community. Consider 2 weeks supply of prescription and over-the-counter medication, food and other essentials. Know how to get food delivered if possible. Establish ways to communicate with others, family, friends, co-workers. Establish plans to telework, what to do about childcare needs, how to adapt to cancellation of events. Stay informed about emergency plans. Know about emergency operation plans for schools and workplaces of household members. How it spreads. The coronavirus is a new disease, and we are still learning how it spreads, the severity of illness it causes, and to what extent it may spread in different countries. How the coronavirus spreads. Person-to-person spread. The virus is thought to spread mainly from person to person, between people who are in close contact with one another, within about 6 feet, through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Can someone spread the virus without being sick? People are thought to be most contagious when they are most symptomatic, the sickest. Some spread might be possible before people show symptoms. There have been reports of this occurring with this new coronavirus, but this is not thought to be the main way the virus spreads. Spread from contact with contaminated surfaces or objects. It may be possible that a person can get the coronavirus by touching a surface or object that has the virus on it, and then touching their own mouth, nose, or possibly their eyes. But this is not thought to be the main way the virus spreads. How easily the virus spreads? How easily a virus spreads from person to person can vary. Some viruses are highly contagious, spread easily, like measles, while other viruses do not spread as easily. Another factor is whether the spread is sustained, spreading continually without stopping. The virus that causes COVID-19 seems to be spreading easily and sustainably in the community spread, in some affected geographic areas. How to protect yourself? Know how it spreads. There is currently no vaccine to prevent coronavirus disease. The best way to prevent illness is to avoid being exposed to this virus. The virus is thought to spread mainly from person to person between people who are in close contact with one another, within about 6 feet. Through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Take steps to protect yourself. Clean your hands often. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, mouth with unwashed hands. Avoid close contact. Avoid close contact with people who are sick. Put distance between yourself and other people if the coronavirus is spreading in your community. This is especially important for people who are at high risk of getting very sick. Take steps to protect others. Stay home if you are sick. Stay home if you are sick, except to get medical care. Cover coughs and sneezes. Cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Throw used tissues in the trash. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least 60% alcohol. Wear a face mask if you are sick. If you are sick, you should wear a face mask. When you are around other people, sharing a room or vehicle, and before you enter a healthcare provider's office. If you are not able to wear a face mask, for example because it causes trouble breathing, then you should do your best to cover your coughs and sneezes. And people who are caring for you should wear a face mask if they enter your room. If you are not sick, you do not need to wear a face mask, unless you are caring for someone who is sick and they are not able to wear a face mask. Face masks may be in short supply and they should be saved for caregivers. Clean and disinfect. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection.